All right, so the questioner was saying that they are confused by the, coronary artery questions on practice exams, board exams. Can you please give an example of questions with the answers 92933RC and 92934-LD? One of the practice questions gave an example of both of these. I need more clarification on how to answer correctly questions from major coronary arteries. So yeah, this is a toughie. Now, I have to give kudos to Ruth Sheets, who's on our team. She does all of our practice exams, and she's awesome. Great rationale writer. So she actually understood this better than me because, you know, when you teach something for, 10, 15 years, you get used to teaching it. And then they changed this on us a couple years ago, and I kept struggling with explaining it right because it's so different. So, but Ruth picked it up, and she actually wrote out most of this answer. So thank you, Ruth, and I'll be presenting it. So, so first, some key ideas. Let me take you down to the bottom real quick to just to get a picture of all of these codes. And this again is in the answer sheet for the Replay Club members. If you look at my little cheat sheet down here, this is my handwriting. I know it's a little bit messy, so bear with me. These are done in a hierarchy. You need to look at your documentation and see what vessels are being worked on. That's the first thing you should do. Write it in the margin of the note. Just write down the vessels. Most vessels have a corresponding modifier, like LD, LC, RC, left descending, left common, right common, left main, and I forgot what RI means. But at any rate, these are the main vessels, okay? For coding purposes, there's 1, 2, 3, 4, 5 main vessels that are recognized in CPT. And the hierarchy of how these work, I've numbered them. This is 92243. That's your first one. 92241 is the second one in the pecking order. Then 92933 is the third one, 92924 is the fourth one, 92937 is the fifth, and 92928 is the sixth, and 92920 is the seventh. They're not in numerical order. So what I recommend you do is take your page, this is page 576 in the CPT professional version, and bubble them like this, and then put the corresponding numbers of that hierarchical order. Now, where did I get this hierarchical order? I got it from the guidelines. And then I confirmed with Ruth I got it right. Okay, so just so you can see the layout of how the codes work, and they're all kind of all over the place. So now let me go back up to the notes. This answer sheet's worth its weight in gold here. So to do this type of percutaneous coronary intervention, which is abbreviated PCI, so percutaneous, they're poking through the skin, they're going into the coronary vessel, and they're doing something. The three main things that they do is a stent, which is like a little cage that they put in there to bridge open the vessel. The second one, they might do an atherectomy, which is like a scraping of the plaque. Okay, it's not an arterectomy, like they're removing the artery, like a lot of my newbie students mistakenly think. It's ather, that means plaque. And then the third one is angioplasty. That's normally the balloon thing where they put the balloon in deflated and they get it right in the middle of the plaque, and then they inflate it, and it squishes the plaque to the walls, and it opens up the pathway a little bit. So those are the three types of interventions that are typically done to these coronary vessels. So keep that in mind. These are the main vessels that, oh, there it is, ramus intermedius, that's the RI. So these are the main vessels that CPT recognizes for coding purposes. If you're coding a branch of a coronary major artery, the modifier you use will be the same as the modifier for the major artery. Okay, so modifiers are really needed here. Okay, so if you're going in a branch, and I'll go, sorry for the scrolling, guys, if I go into a branch, I did write the branches on my cheat sheet here too. The left descending has 2 diagonal branches. The left common has 2 marginals. The right common has a posterior descending and a posterior lateral. And then the left main and the RI, they don't have any. So you don't get to use any codes. They don't have any branches, okay? But if you did have a diagonal, its modifier would be LD. If you did have a marginal, its modifier would be LC, okay? And there are no modifiers for the others. Well, they wouldn't apply, I should say, okay? Okay, next, you need to realize which coronary artery branches are recognized. We just went over them. According to the guidelines, the following branches are recognized. Up to 2 coronary artery branches, those are the diagonals. Up to 2 branches of the LC, those are the marginals. Up to 2 branches of the right coronary, those are the posterior lateral and the posterior descending. The left main and the ramus intermedius do not have any. So, the base codes are 92920, 924, 928, and 923. They can be coded for a major artery or a branch. Okay? The add-on codes 92921, 92925, 929, and 934 can only be coded for branches when some base code was applied to the same major artery or another one of its recognized branches. Okay, and this is coming right from the CPT manual. PCI performed during the same session. In additional recognized branches of the target vessel should be reported using the applicable add-on codes. Okay, this is one, guys, that you really need to read and reread the guidelines and really noodle on it. Also note that the add-on codes for PCI have parenthetical notes stating which base codes they can be used with. So I'll show you that real quick, going back down to my thing here. You see 92921. In parentheses it says you can use it with 92920, which we would kind of get because it's in the same bubble, it's indented, but you can also use it with 92924, which is a parent code in the next bubble, 928, 933, 937, 941, 943. So pay attention to these parenthetical notes and they'll clue you in what it's legal to use them with. Okay. Now to get to your question, 92933 RC and 92934 LD, that was an answer on a mock board exam question. It's impossible to have just these 2 codes, so that's why it's a wrong answer, because they have mixed modifiers. Okay, it has to have the same modifier if it's that add-on code. So this pair of codes with no other base code for LD. Okay, so let's go find 92934. 92934. Here we go. So 92934 is an add-on code. We just read that guideline that it has to have the same main vessel. So the modifiers would match. Okay? So this pair of codes with no other base code for the LD would violate the guidelines because you have to code for the PCI in the main target vessel or branch of LD using a base code before you can possibly code any of the add-on codes for a branch of the LD. Okay? So one example of this combination of codes, PTCA, percutaneous transluminal coronary atherectomy, that's that plaque removal, with intracoronary stent for right coronary artery is coded 92933 with an RC. Percutaneous transluminal coronary atherectomy with intracoronary stent for a diagonal branch, D1, of the left anterior descending artery, you're going to code as 92933LD. Okay, so just an action plan to get more up to speed on this. This particular question, I could probably spend an hour on it. This could be a content webinar that we could do if you're interested. So read the guidelines on page 574 to 575. It's a whole page of guidelines. And then highlight the keynotes the way I showed you that I did in my book, and bubble and highlight those codes and make some little cheater notes. Now for those who are in the replay club, they really would love something similar to this answer sheet. There is a forum post on our site. If you go to cco.us/forum, this is the link here, and that will, Ruth kind of went over this. Let me see if I can go show you that real quick. Okay, so if you just type in the search box, if you typed in major coronary arteries, it would find this thread for you, and you can see Ruth really broke it down very, very nicely. Okay.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.